Welcome back to another episode of Living Vividly. I am Jackie Heddich, your health coach.
And I am Daphne Olivier, the unconventional dietitian.
Today we're sitting down with Stacy and Kenny Maggard, the founders of Azalea Health Services, to explore mental health care for older adults, particularly those living in nursing homes and long-term care settings. We'll talk about why emotional and psychological well-being matters just as much as physical care as we age, the patterns, challenges, and successes that they've seen firsthand. We'll also explore what it looks like to build a mission-driven healthcare business together as a married couple, balancing compassion, leadership, and a shared purpose. This episode is about care, dignity, connection, and supporting people well at every stage of life. Kenny and Stacy, thank you for being here with us.
Thanks for having us.
Yeah, thanks for having us.
So, how did this all come about? Let's talk about the background of creating.
So, I guess Stacy's background and my background are very different. Like, she's good at things I'm not good at, and I like to think I'm good at things that she's not good at. My background was more in like banking and finance, while Stacy was kind of more marketing, PR, communications. And, you know, just kind of as we were working through our careers, as we started a family, Stacy had been staying home with our children, and being a part of an entrepreneurial journey from like the outside looking in, that was something that, you know, I guess we're gluttons for punishment, and felt like that was something that we wanted to do, you know, ourselves. And ultimately, you know, we didn't really know what we wanted to do. We felt like we wanted to own a business and thought the right path was going to be to go and find a small business that we could buy and operate ourselves. And in doing that, we found a group out of Florida that built a practice like what we're doing now. And it's, you know, providing one-on-one mental health counseling to seniors in nursing homes, assisted living communities, and other senior care settings. And while doing a startup was certainly not something that I was excited about or wanted to do, from my past experience working with healthcare clients, it just felt like mental health was a big problem and there wasn't enough people to fix it.
And in that population, it's more, I'm going to make the assumption that it's more of a problem than in the average, you know, not senior population, I don't know, adult population. And it's not being served. I mean, that's a very niche population, and that's not being served for a need that's pretty high.
Yeah, and I feel like it kind of had like the taboo, you know, that generation definitely didn't talk about their feelings, and they definitely didn't talk about it to a stranger, you know.
Right.
So, for sure.
Yeah, and so it just felt like an opportunity. Like, how exciting could that be to make our little dent in that big problem? So we jumped head first and said, you know what? All right, well, we're going to do a startup, even though it wasn't really what we were seeking to do. But it felt like a very worthwhile mission, is what it felt like in the beginning. And so it was like, okay, that's the direction we're going to take.
Does it still feel like a worthwhile mission? You said in the beginning, like in the beginning it felt worthwhile, but now it's like, whew.
Look, I mean, the entrepreneurial journey is certainly, you know, I often say it's, you know, from the outside looking in, success looks like a straight line going up. And certainly whether it was previous jobs or other professional endeavors that we had been a part of, you know, you feel the ups and downs more, but ideally you zoom out and you have that straight line. And certainly that's what it's been like on the entrepreneurial journey. But, you know, to your question, 100%, you know, for me, this is the first thing that I've done that is mission driven, and everything that we do is driven off of a patient visit. You know, obviously everything else is important. There's a lot that goes into having a patient visit. But yes, 100%.
So when did you realize, so you're coming from banking, you're coming from marketing, that's very, like, not a whole lot of emotions in banking. Like, when did you decide?
Oh, they have emotions in banking.
Bad emotions. When did you realize that you needed to have, I mean, obviously you're dealing with an older population and this is people. When did you realize that kind of your mindset had to be mission, people oriented, and how you were going to design this business?
Early on, when we first started our company, right? Like, so I said, everything's driven around like a patient visit. you can't have a patient visit without a patient. You can't have a patient visit without a clinician. And obviously there's a lot of other pieces that go to that. But very early on, it's like, okay, well, we've got to get some clinicians or a clinician to be able to get started. I was driving to New Orleans. Again, we had just started the company, had not had, a clinician on board yet, but I was going to interview a potential clinician who has come on board and still works with us today. But while I was driving there, you just kind of, a lot of windshield time. And I was thinking about, I had lost my dad a few years before that, and my sister would talk about how like dad would like show up in her dreams and stuff. And I'm just like, come on, Dad, like, what's up, man? Like, I'd love to hear from you. And so there was a video that my dad had recorded about 18 months before he had passed away. And, Dad, he was a big old redneck, oil field service guy. But he and his best friends, they had talked about starting a barbecue ministry whenever they retired. And this video, I'm a junior, so he's, senior. And the video was, hey, Kenny, how did you get involved in this barbecue ministry? And it's just a few-minute video, but Dad talks about how, Steve kept talking about, his good friend Steve Freeman, like Steve kept talking about wanting to do this. And I was like, well, I like barbecue, I like ministry, but I don't know how that goes together. And so, but he said, I like Steve, so we'll do it. And then like Hurricane Harvey hit and they fed like 1,500 people, like smoked pork butts, briskets, all that kind of stuff. Right. And like, it's pretty awesome. I remember, how proud he was of that. But he talks about a story where they were feeding some homeless families. And he said, he's on the serving line and this lady walks in pretty late, big smile on her face. She says, hey, sorry I'm late, I had to work. Is there any food left? And Dad said, oh, there's plenty. And she said, what's your name? And he said, Kenny. And she said, oh, that was my son's name. And he said, and my dad gets choked up, and I have a hard time not getting choked up thinking about it. But he said, that's when it really all came together. They were all grateful. She had a big smile on her face. We had some fellowship that we wouldn't have had otherwise. And, I think we brightened a day. And so, as I'm driving, listening to this, and I'm like, well, this is way better than a dream. Like Dad's screaming at me, like, you're literally going in the right direction. This is where you're supposed to be. Like, go get it. Because every time one of our clinicians sees a patient, it's a chance for them to put a smile on their face, have some fellowship they wouldn't have had otherwise, and brighten a day. And we say that often. I said it this morning on, an interview with a clinician. It might not happen every visit, but it is an opportunity for the, 1, 2, or 3 of those things to happen every time a clinician sits down with a patient. So, so that was like early on where it's like, your kind of metals getting tested, am I really doing what I'm supposed to be doing? Is this going to work? All those things. And it was just really like a reminder that, certainly hold on to and don't forget.
I did not set you up for that question. I did not know what the answer was going to be, but that was perfect.
And I think Kenny, just to add to that, like the part that he didn't mention, like whenever we were looking to start a business, that's not entirely true, because I was like, for the first time, right? For the first time, like all 3 of my kids were in school full time, and I'm like, what am I going to do with all this free time? And Kenny was like, hey,
buy yourself a job.
Yeah, I got a job for you. And I'm like, wait, what? But I think like, hearing that story and living that story, it's like, it's an adjustment. It still is an adjustment to be like a mom and a working wife and all the things. But it's like, to me, that's like, that just is such a like focus and like a mission that like, I'm like, this is all part of the plan. And like, I just kind of surrendered and was like, this is where we need to be. And this is what I need to do.
Something bigger than you.
For sure.
That's beautiful. So what exactly does Azalea Health Services do? Like, what is the core service?
Yeah. So if you think of, I'm sure we all know people, family or otherwise, that have lived in a nursing home or an assisted living community, whether, have personal experience or otherwise. But so if you think of a resident there, like, look, we're all, and I've certainly come to understand this a whole lot better, through this journey, but we are all human beings that are a product of our life experiences. And so certainly, you can think of like some of maybe the obvious things, like you live in a nursing home and maybe you're having a hard time with that. You would like to live in your home where you raised your family. And it's just maybe a hard thing to kind of get past and find quality in the life that you have, or your new reality. Also, other common situations: grief, depression, anxiety, loneliness, behavioral issues, very common situations that we all either deal with in some way or another, or are around it with people that we love. And so we bring clinicians that are typically licensed professional counselors, licensed clinical social workers. They go into the nursing home and they visit with that resident one-on-one. So they conduct a biopsychosocial assessment where they're looking to get to know the individual, try to understand maybe what they might be struggling with, and then they'll come up with an appropriate diagnosis and treatment plan. We don't do like medicine management. Certainly that can be a part of the component, and we can collaborate with the folks that are doing the medicine management, but our clinician is going in there as often as their treatment plan calls for. So like, weekly visits, more than once a week, every other week, something like that, to help with goal setting and talk through whatever that person might need to talk about or talk through.
So is it always in person?
Yes. We do have a small patient population that is telehealth, and those are folks that are not living in senior living settings, like so in a private residence somewhere.
So my first job after I became a dietitian was, so I did my internship at the VA hospital in Tampa, and attached to that hospital was a nursing home. And of course, I was like, oh gosh, I'd never want to work in a nursing home. It's just not the population that I see myself working with. But I did because they offered me a job, but it was attached to the hospital. I mean, it was a higher acuity nursing home than what your average nursing home would be. But there were plenty of people that had been there for years and years and years. And that was probably my first time actually being intimately involved in a nursing home. I didn't have any really family members that had been in a nursing home. And the setting was, as a job, it was probably the best job that I could have had initially out of internship. But because you got to know people, they were there for a long time. So with that population, there are people that have lived, assuming that they are an elderly person or, like an actual senior, they've lived a lot of life and now they have a lot of time to just sit around and think about, the things they did right, the things they did wrong. So I can imagine even in that population when maybe they've never seen a counselor before, it's never been something that they've even considered as a possibility. There's a lot of emotional stuff that bubbles up. And so I think it's a great population. And then with loneliness, they're there without their family. Potentially their family hopefully comes to visit them if they have family still around. But the level of loneliness, I would imagine, is pretty strong too.
Yeah, and when our counselors go in, they're not like, "Hi, I'm a counselor and I'm here to solve your problems." They're like, "Hi, my name's Stacy. I was just coming to visit with you. You have some time to chat with me." They're very like a soft approach. But yeah, like what you were saying, like loneliness is a big one, and the staff, it can only do so much. They're also busy. So just having like a regular visitor, a happy, familiar face to just go and talk to them about whatever they want to talk about is so enriching to their lives.
Yeah.
Do they know that they're getting counseling services?
I mean, they've signed the consent form, or like a family member has. But yeah, we don't
like infiltrate. Like,
yeah.
Surprise.
A soft approach, but everything's on the up and up.
Got it. Yeah.
Yeah. I mean, I don't think it's an effective approach to be like, like Stacy said, I'm here to fix all your problems. Like, again, a licensed professional counselor, licensed clinical social worker, very educated, experienced individual, just to get to have that license on day one. They are accustomed to working with folks, this population as well as all other populations on walking through whatever they might be struggling with, and kind of the right way to approach, because everybody's different. Some people are like, get out of here, I'm not crazy. And it's like, nobody said you were, so it's just kind of all different different types of folks.
Yeah, probably besides I just moved into this place, the shock of your whole life changing and that initial kind of reaction, I'm sure there's a lot of like long-standing patterns that these people have been dealing with, or they might be starting to get confused. I'm sure, I mean, you're not counselors, but how do you guys navigate that? Such a unique, because I'm only 37, so I'm, I have some pretty solid bad habits that I've been doing most of my life. But by the time I'm 90, it would be even harder to kind of change my way of thinking. That's very unique.
Yeah, no, absolutely. What I would say to that, like, you're right. Stacy and I are not counselors. We're not clinicians. Our clinicians have 100% clinical autonomy, right? We're very intentional about not getting
in the weeds.
In the weeds, in between, patient and clinician. That would obviously be inappropriate. And so we let our clinicians do what they do best. Whenever we have a new referral, we, send that person's information to the clinician. We make sure that, they're aware of, anything that we've been made aware of about this person. But ultimately, there's typically a point person on the staff that can help, kind of give, kind of fill in between the lines, so to speak, and make the introduction, because that staff person is a friendly face. Our clinician is soon to be a friendly face, but to try to give the best chance of success, where it's like, okay, someone that is, again, a friendly face introducing, a new friend there, and let that clinician figure out if there's a way to kind of navigate, through that. Because I'm with you, Jackie. Like, I have plenty of bad habits, and I don't see that getting better as time goes on. But there's unique things that you deal with any population. And one of the things that often comes up is dementia, with this population. There's no playbook for treating dementia. Everyone's kind of on their own place on that journey. And the reality is like, unfortunately, some people are going to be too far along that journey to be able to have a cathartic relationship with a counselor. But, the recommendation to the staff or whoever may be referring someone to us is, if you think there's a chance that this person could benefit from trying counseling, let our clinician go in and visit with them, and they can determine clinical appropriateness and how best to, proceed from there.
Even just having someone to visit them regularly sounds therapeutic. Mm-hmm. A lot of these people probably don't have.
Yeah, I can speak for my dad. I'm going to speak for my dad. He's not in a nursing home, but he's alone. And just to have, whenever I call him on the phone, he just wants to talk. And literally, it doesn't matter if I'm even listening. He just wants to talk. So to have that friendly face that he can talk about whatever. I mean, he's talking about the price of silver. He's talking about the LSU recruits. That was our conversation this morning. But just to have a friendly face to just be able to have a conversation with, and maybe they can go and, crack open a few things that they can talk about that are more mental health focused to help them just kind of reframe their situation, I think would be a great opportunity. That's, again, when I worked in the nursing home, now we're talking like 25 years ago, there were mental health people there, but it was more in the way of keeping the connection with their family. So it wasn't like a counseling session that they would get to go to. So I think it's brilliant. I think it's a great opportunity for people who really, it's a service that needs to be met that has not been met up until this point. So y'all service all of Louisiana?
So we're in most areas of Louisiana today. So basically, whenever we have there's a lot of great clinicians out there, and we are a great model for some of them, is the way that we think about it. And so whenever we have a great clinician that we bring on board, we essentially build around them, because we want our clinician to be able to go into places that are convenient to kind of where they live, work, or play. And so, yeah, we're in most areas of Louisiana today, as well as in Houston, Texas.
Oh, wow. Okay.
So you are focusing on mental health services. Is there any future where you bring in like physical health, or are you just going to stay, like other therapies, I guess?
Yeah, in the settings that we work in, they typically have like PT, OT, speech therapy, that sort of thing. We're a young company. We're celebrating 3 years this year, which we're really proud of. So certainly wouldn't like rule out things for in the future, but we've got plenty on our plate to chew with the service that we're offering, and so we're focused on doing what we do and doing it as best, being the best at what we do.
So let's talk about you guys. Y'all share an office. Has that been?
We do.
Except for whenever he's in his car, truck driving around. I don't think I've worked with my husband indirectly. We both ran Vivid together, but we weren't sharing an office together. And I don't know how that would have played out. But has this been a challenge? Is it fun?
I 100% know that my husband cannot work together. We can
so many people tell us that
together really well, but we do projects like outdoor projects together, and I'm like, yep, we are not meant to work together.
I don't want to do those projects with her either.
Putting together furniture or anything is totally different than running a business.
It's been an adjustment. It's been a lot of communication, a lot of figuring out. We've been married for 18 years.
Almost.
So, just figuring out, I've never actually worked with him. So I'm like, I know now, like when he's doing this, that I can just wait till ask my questions till later, because he'll very much be like, I'm in the middle of something. And same with me too. Like if I'm in the zone, just boop, let's not talk right now. So it's been a lot of education, even though I think we know each other better than anyone else in the world. We're still learning. But yeah, and we're definitely not perfect. It's a work in progress. But also, like Kenny said earlier, we have very different strengths and weaknesses. We're, what he's good at, the financials and the dollars and the money, that is not my thing. Same with him with marketing and outreach and stuff. That's not his thing. And also I think we've built the business to where if he's out of the office, I can pretty much do everything he can do. He can definitely do everything I can do, which is really annoying. But yeah, so it's been a
maybe.
What do you think?
This is the most common question that gets asked from friends, right? Especially people that have known us for a long time. And the easy answer is we've always fought personally, and now we fight professionally as well. But no, I think it's certainly an adjustment. I don't do well sitting in an office every day. And to Stacy's point, she's helped me become aware of maybe some opportunities for improvement.
Such a good way to put that. I love that.
Very elegant.
Clip that.
I've got to work with her and then live with her. But no, you learn, I guess, a lot about yourself whenever you're in different situations, and working with your spouse was a different situation, or has been a different situation for us. I'm learning more that maybe people that think they're great at multitasking, there's probably very few people that are, but I know that if I need to focus on something, I need to have a kind of a hard sprint at what I'm doing and have blinders on to be able to make sure that hard sprint happens. And to Stacy's point,
you're focused.
I'm focused, and I'm trying to not be unfocused.
Got it. Well, I don't take it personal anymore. Yeah. Before I'd be like, when I just storm out of the office.
It's hard to take the spouse hat and the coworker hat off. I do have experience with that. Like I said, Sean and I ran our business, and during the time that we had it, there was some friction, because just like you, he was very much the business guy and I was the marketing and running the business day to day. But after the fact, after we closed, he expressed, I was so proud. He learned to respect me in different ways. I didn't even realize how capable you were of this thing. And so it was cool to be behind the scenes. I had never worked with a spouse before either. So it was cool to see the other part of my spouse and kind of gain respect and respect him in different ways. So that was a blessing.
Yeah, I think the way Stacy says it too is offer lots of grace. Because again, I'm not trying to be aggravated with you. I'm just like, I have to get this done, and like I'm focused, and like that's just, maybe it's my personality or whatever it is, but just kind of understanding, each other's boundaries in a different setting. But building this with Stacy, I mean, I say it all the time, like we're very proud of what we've built. We're even more excited about like, continuing to grow the impact, because for us not being clinicians, I can't go sit on the proverbial couch and like, offer counseling services to anyone. But for us to be able to be a small part of the impact, the direct impact that our clinicians are having, it's very humbling and it's very motivating. And knowing that we've been able to build that with a great team of clinicians providing services is, it's been awesome.
How many clinicians do you have on staff?
So we're float around like around 25.
Okay.
And we just hired our first like part-time assistant in the last like quarter, which is a big deal.
That is a big deal. In 3 years, congratulations. That's a huge feat.
Yeah. Again, operating within, the realities of providing services for typically Medicare and Medicare Advantage patients. We focus on trying to do this as efficiently as possible, so that way we can make the biggest impact that we can with the realities, like I said, of working within Medicare and Advantage plan realities.
So your services are covered with Medicare.
Correct. I mean, like if I'm speaking with a staff member at one of these communities, if your resident has traditional Medicare, there's no out-of-pocket costs for our services, and most of the Advantage plans do as well. So, we'll occasionally come across some Advantage plans that maybe have much larger deductibles or co-insurances or things that like, most of the plans don't have. But again, traditional Medicare, good to go. Most of the Advantage plans as well.
So it's easy access for most people.
It takes one big barrier out of the way. Someone was saying earlier about the population, being open to like, this type of care. And when it's presented with like, oh, it's a friendly face that can come in and like talk to, help with loneliness, having that regular visitor, maybe working through some things that are deeper than that. You might never get to that point with some people if they're just like, oh, I can't afford it. If that's the first thought that they have, if you can lower that barrier, there's a better chance that there's going to be some really quality outcomes.
Do you have any examples of like happy anecdotes or success
stories? Yeah.
Thanks.
I'll give a couple of stories. Like I said earlier, it's rare that we like interact directly with a patient. That would be more like, one of the stories when we first started our company, I'll never forget this, sitting in the lobby waiting for a meeting with the staff, and this sweet lady's, sitting in her wheelchair waiting for a ride. I think she was going to a dentist appointment. And we just started talking. And, I found out that her husband worked for an international paper. They lived in 4 states. They raised their 4 kids. Most of them went to La Tech, but one went to LSU. And I thought it was very sweet that she was like, did you know? And she said the person's name. I was like, that's very sweet that she thinks I would know her child who's, closer to my parents' age, But that was an early kind of aha. She may never be a patient of ours, but she represents who we are here to help. I think of another story where, resident of an assisted living community, her 50-something-year-old daughter was her primary caregiver, spent a lot of time at the assisted living community, left on a Friday, had a massive heart attack and passed away in the grocery store. And so, the 50-something-year-old daughter who's now deceased, her husband, who's dealing with the loss of his wife, is now also trying to fill that primary caregiver gap for his mother-in-law. And so we're hearing from the staff whenever they're referring this resident to us, she can't really express the emotions she's feeling because she would feel guilty because the son-in-law is dealing with an enormous loss. And I get goosebumps every time I think about stories like this, because that is a primary example where, an unbiased third party who's educated and experienced in working with folks through these types of things can walk in there and that lady can just scream at our counselor, and our counselor would be okay with that. And there's no guilt because that might be what she needs to do.
Yeah, the counselor has the tool set or the toolkit to be able to walk her through the grief process that she's going through.
And then she doesn't feel like a burden.
Exactly. I think of another one where one of our clinicians was talking about how a lot of the patients she works with, she feels like they are packing their suitcase. And maybe there's some like loose ends that they're unsure how to kind of tie up. And, just getting these different perspectives, again, whether it was I happened to be visiting with a resident just sitting in a lobby, talking through it with staff or with our clinicians, it's constant reminders and reinforcements about what we're doing and what that mission is. Because again, it's an opportunity to put a smile on somebody's face, give them some fellowship they wouldn't have had otherwise, and brighten their day. And it's pretty awesome to be able to be a small part of that impact.
When you think about that population, they've had assumingly decades of life experiences, both good and maybe not so good, just because that's how life be lifing, it's just you get a lot, and there's potentially decades of things that they've never been able to unpack with anyone. So now that they have all this time, because if we're real, a nursing home, assisted living facilities are a little bit different, but in a nursing home, there's not a lot of activity happening. There's just not
you from yourself.
Yeah, from your thoughts. And if you think about how long one night can be if you can't sleep well, and just all the thoughts, so whenever that becomes your now daily and nightly pattern, there's a lot of brain activity that can be happening.
Especially in the fourth quarter of life when you're trying to reconcile all of that. Like, okay, how do I come to terms, or how do I deal with this? And having the opportunity to, kind of close the door on some of those things is such a beautiful, a beautiful chance that they get.
Yeah, no, absolutely.
When I make a lot of the phone calls to the families too, and just mom's in the nursing home, can you sign the consent? And then next thing you know, I'm having a 20-minute conversation, and she's telling me all about how mom used to be this and that, and she's just watching her decline. And I've cried on the phone with them before, I've prayed with them on the phone before, and it just really ties you to the work and what we're doing, and those kind of things just remind you of why we're doing what we're doing.
And you guys, I obviously know you guys personally, so I know this about you, but that industry it's an industry, taking care of our older population. It's very much profit driven typically. So to have services geared towards those people, that when you think like this and you have the mindset where we're taking care of them, truly, it's so different than most of what they're dealing with. Mm-hmm. It's just a conveyor belt of money for the most part, these privately held nursing homes. I'm not going to generalize all of them, but it's an industry. So just knowing that you guys have this loving mission towards them is so wonderful to see.
Thanks.
I don't have a follow-up question. It's just so nice.
People still care.
What we find, obviously there's exceptions to everything, but what we find, and I've been in a lot of nursing homes and assisted living communities the last few years, the vast majority of staff that we interact with are well-intentioned, good people that are trying to provide quality care for their residents with limited resources. And this might be literally a nursing home that you feel like you're going into a country club and you go through a gate, like a gated community, a nursing home that is the opposite of that, and everything in between. The amount of things that are put on, let's say a social worker in a nursing home, the amount of requirements that are put on their plate, it's enormous on what they need to do to perform their job, to be in compliance with state regs and everything. And, one other story I think about as a social worker in New Orleans, she sat down with one of her residents in the library and they read, for 30 minutes. She was reading a book with her, and she talked about how impactful that was for that resident and how much she wishes she had time to do that all day. and didn't want to close the book whenever she was like, had to go back because all the boxes that need to be checked for her to complete her job. That's something that our clinicians can do. And so, the message, whenever I'm speaking with staff in a building is, look, we want to help your residents. Any of your residents that are appropriate for counseling, we would love to be able to help them. And, we've got plenty of staff in other buildings that we are working in that would say how that has made their job easier and more fruitful. Like a success story I think about is wife moves into the nursing home. So now her and her husband are living separately. Then husband moves into the nursing home. Now they're living together again. And now the staff is hearing about all their marital problems and all the fights and all that stuff. Our clinician visited with them individually, with them together. And, the follow-up to that was, oh, we don't hear from them anymore. Like, that is something that they deal with whenever they're discussing that with their
learned how to work it out.
Yeah. But having somebody with the tools to be able to do that, again, the stories are very impactful and meaningful, and that's really what drives us.
What makes a resident appropriate for counseling? In my mind, they would all be appropriate, or maybe 90% of them. Do y'all have a basic checklist or something that makes residents appropriate for counseling?
So it's mostly us educating the staff in the building about what our services are and how we can be helpful for their residents and their staff. Whenever you look at like a demographic face sheet, which would be something that they would have on every resident, so obviously going to talk about all their demographic information, talk about, maybe some diagnoses that they have, maybe medications that they're on, that sort of stuff. It is, I've probably said it a few times here already, but like it is very common situations that people are typically, we may have a bipolar schizophrenic person referred to us, and we, there's a good chance that one of our clinicians can probably work with them and help them as part of whatever their treatment plan is. But it's typically very common situations: grief, depression, anxiety, transition adjustment, loneliness, behavioral issues. And so the message is, if you think the resident could benefit from counseling or attempting counseling, then that would be an appropriate referral. Somebody that's isolating, somebody that used to go to bingo and now they don't, somebody that's crying a lot, just got a tough medical diagnosis. Yeah. And you hear often too, like, I remember one lady that was a self-referral that said, I've done counseling at different times in my life and it's been very helpful and I can deal with things, but I've lost 4 friends in the last 2 months. And it's like, who's equipped to handle that? So it's various reasons why someone would be referred to us, but it's typically common situations where there's telltale signs.
So if you're dealing with a family member who might have an aging parent, what advice would you give them about seeking mental health therapy or support?
Why don't you talk about like whenever because you speak to families probably more than I do.
Yeah, when I call the families and they're like, what is this for? And I just explain our services, they're also usually excited to hear that there's no out-of-pocket expense. But just kind of walking them through the process. We have a really exceptional therapist that goes there and we'll meet with them in the privacy of the room. It's just the conversation's just between them. And then we'll let you know if anything, if something were to drastically change, if they were like going to bingo and now all of a sudden they're not, we would have the therapist alert the family. But, I think for like my parents, if my parents were in this kind of setting, like I would absolutely love to have this resource and this option for them. And I'm in town and I see them all the time, just to have somebody, a familiar face to talk to and a regular visitor. And we don't get a lot of immediate no's every now and then, and I think it's just depending on the area we're calling. Some areas of the state are a little more skeptical than others. I'll let you draw your own conclusions. But there was something else I was going to say.
While you're saying that, like when you brought up your parents, this might be to something y'all had brought up earlier, but when we were kind of doing our research and figuring out like, is this something that we think, one, is it real? Like, is it a real need? And like, two, is it something that we think that we can deliver, that we can do? I remember talking to Stacy's mother, who was, the primary, caregiver for her mother towards the end of her life. And, today's actually Mima's heavenly birthday today.
Happy birthday,
and my
Mima.
parents' anniversary.
And her parents' anniversary.
It's a big day.
But in talking to Stacy's mom, it's just like, just thinking of like stereotypes, and would geriatric folks be interested or even be willing to, to do counseling? And she said, wait a minute, you mean to tell me that somebody would go and talk to Mima and listen to her complain as long as she wanted to? She'd sign up for that tomorrow. She said, I would sign her up for it. And so that was one of the anecdotal things as we were, again, trying to decide if this was, a real opportunity, and a real opportunity for us. That was kind of one of the meaningful things that I remember.
Well, before we let you go, we always ask our guests one final question, and I failed to prep you for this, so sorry. What does living vividly mean to you guys?
I would say, and it'll probably reiterate some of the things that we've talked about today, but running a mission-driven company is something that, while I've had some really rewarding roles in the past, running a mission-driven company is something that you can't replace, I guess, like the way it makes you feel, because, you feel harder. Like I say, like, the highs are higher and the lows are lower. And so you work on managing both ends of those. Don't get too excited. Don't get too down. And sometimes the punches come at the same time, and then sometimes the highs come at the same time. And so it's just kind of working through that. But being able to, and, certainly just being here today and sharing some of the stories, it's always great to remember, and it brings you back to the mission of why we are here, and it's something that's awesome that we, our kids ask questions about it. We talk to them about it. I recently got to bring Cooper to a meeting, and it went okay. But anyway, I think just, I don't even know if I'm answering your question, but to me, is running a mission-driven company is something that it's just more rewarding than I could have realized before I got into this role.
That's a good answer. You answered it.
Okay.
Every answer is different.
Yeah.
That was awesome.
I think living vividly for me is like living out your purpose and following, the path that God set for us. The fact that I get to do this with my husband, and like he said, showing our kids, that not only are we married and we love each other, we also like each other. We work together. And like, it's awesome. We've built this business to have the flexibility, and the season of life that we're in is such a gift. Kenny gets to bring our kids to and from school every day. If he travels, he's usually home that afternoon. I mean, it's just, I don't know. Sometimes I'm like, I can't believe that, like, I get to live this life, and I feel so abundantly blessed.
Thanks for listening to Living Vividly. If you enjoyed today's episode, please leave us a review and subscribe. We'd love to hear from you. For more resources and details from today's discussion, check out the show notes. Until next time, keep living vividly.